In Humansdorp and surrounding areas of the Eastern Cape has prompted the Department of Social Development to mark International Day Against Drug and Abuse in the area. A report by South African Medical Research Council shows that 11% of South Africa's population suffers from an addiction disorder in their life. The theme for this year's campaign, which coincides with Drug Awareness Week, is drug control. It aims to inspire people and mobilise support for the curbing of the supply of drugs in communities. Let's cross now to Iviwe Poti, who's in studio in the Eastern Cape with the Social Development Minister to find out a little bit more about this initiative. Iviwe, thanks very much for joining us. It is a significant problem, I would imagine, in the province, and these kinds of interventions are critically important.
Well, definitely, Peter, and a very good afternoon to you too and the viewers. And just to make clear there, I am with the spokesperson of the department here in the Eastern Cape, Mzugisi Solani. And just looking at the Eastern Cape, Peter, as a whole, there is a rife use of alcohol and drugs, but mainly alcohol, because you will remember that this is an area where a lot of people, specifically those, who find themselves being unemployed, impoverished and living in dire conditions, are working in your agriculture sector, farming. And then if you look at the Sarah Bartman district area, which is the most affected area by alcohol abuse, and as well as your FASD, meaning children that are born with issues resulting from their mothers drinking while they were pregnant, that's the area that is most affected. And if you take it a bit further and you look in terms of when the youth actually start drinking, in terms of stats and research done by this department, it is said that people actually start drinking at the age of 10 in the Eastern Cape, in certain areas of the Eastern Cape, and 1 in 10 children are affected by FASD, and as well as 13% just here in the Nelson Mandela Bay Metro, in areas such as Bethelsdorp in grade 1, are affected by fetal alcohol syndrome. But we're going to speak to Mzugisi Solani to tell us a bit more in terms of, Mr. Solani, paint us a picture when we speak about the issue and a very huge societal ill in the Eastern Cape, not only just the Eastern Cape, but South Africa as a whole, when it comes to the abuse of drugs and alcohol.
Well, good evening, and good evening to the viewers. I like that you start with the statistics, and statistics sometimes are very good to contextualize where we are. And if you look in those statistics, obviously you can see that we are facing a challenge in the province. As you said, it's not necessarily the Eastern Cape problem, but it's much more prevalent, especially to young people, which is becoming quite worrisome, because you find that even the age range of children who are starting to consume alcohol, it's quite problematic. Although we're not saying that elderly people, who are consuming alcohol, it's okay. But once you start to have children starting to consume alcohol at a very tender age, especially those school attending children. The other day you went to the Sarah Bartman region, where we went to a particular school, and you had teachers reciting a problem of primary school children who are starting to indulge in substance. Those are instances that are quite worrisome. When we also interacted with the Eastern Cape Liquor Board the other day, they were raising quite another new dimension, where people who can't afford to buy alcohol over the counter, they are starting to concoct their own alcohol at home, which is another dynamic that we've got to deal with. So it's quite a vast challenge, and it's coming in different directions. And that is one thing that we are also concerned as a department. We are investing quite a lot of money to ensure that we pay attention to preventative measures rather than to deal with people who are already indulgent on the substance and also in alcohol. So we have invested, as you have seen today, we are dishing out a lot of money to community organizations, because solutions are not lying with government, solutions are lying in communities who are going to be dealing with behavioral problems that are happening in their own communities.
And then, Mr. Solani, when we speak of these substances, and also once again referring and looking at the stats, South Africa being the second largest where people have actually contained or taken away cannabis, which is actually known on the streets as weed. Also in South Africa, we have this drug that's on the streets called Wunga, which is a mixture of rat poison, ARVs, etc. Those are the things that people create at home and find easy to access. During today's program in Humansdorp as well, in terms of education, educating these youth that it might be easy to contain, but how do you educate them in terms of stay away from these substances?
We are using young people to teach other young people. We've got a very working intervention, especially when we're using teenagers. We've got what we call teenagers against drug abuse. Those teenagers are available in each and every community, and we are subsidizing them, especially in their programs, because what is important is to start at the tender age and using the same constituency where there is a problem. That's why we have invested a lot of money in young people who are going to act as examples, pockets of examples for other people at schools. So we are pouring a lot of money there, and when we're pouring that money, obviously we are not working alone as a department, because we need to be engaging with quite a lot of other units that are working in this space. That's why I mentioned the name of the Eastern Cape Luca Board, which is quite an active partner to ensure that, when we intervene in a particular community, we are not only intervening as one department, but we are intervening to make sure that we change behavior, because that is what is important, to change behavior, to understand that if you consume wunga, you are likely to end up in a mortuary. If you consume alcohol, you are likely to be stunted even in your own personal growth. So those are the things that we are attending to, but we are using young people to do that.
And then I think just lastly from our side as well, for the parent at home coming from an impoverished area or situation or background, where are some of the rehabilitation centers should they not be able to access a social worker that can help with a child or someone in their community with this issue, and also highlighting the impact of drinking during pregnancy, which then leads to the stunted growth or FSAD with the children that are born through these processes.
Fortunately, today also we took you to a particular area in this particular province, which we call the deciduous fruit producing area, which is much more your areas that starting from Jobetina, Humansdorp down into the Langkloof area. That is one of the major challenging areas, because the reason for that is that in this particular time of the year you have a lot of people working, and there's a lot of money around, and people, they start to indulge even in stuff that they would not have been indulging into if they did not have money. So there's a lot of money flowing. As a result, we have pregnant parents who indulge during pregnancy. As a result, you've already mentioned stunted growth, and there are also cognitive problems, because if you have a child where you have consumed alcohol during pregnancy, even the mental growth of that child is likely to be affected. Those are the things that we're picking up, working with other sectors, the Department of Health, and they've done a lot of research, especially in that particular area. And we are also investing a lot of money in that particular community to ensure that, as I said before, solutions are not going to be found in a very fresh ventilated office somewhere in a government department. Solutions are going to be found in communities. So we are giving a lot of money to community organizations. Secondly, we've got a state-of-the-art treatment center in the province, which is a state-owned, free of charge. Remember, to rehabilitate is quite a very expensive exercise. So what we've done as a department, we invested money, almost 16 million, to build a center. It's a provincial center which is based here in the Nelson Mandela Metro. For people to access it, we understand it's always been a challenge because it takes a limited number of people. But what we have realized that we are trying to unbundle it in a way to make it much more accessible for a person who is down in Nkanduli, a parent who's got a problem with a child who is addicted to substance, must find a way of bringing the child over. But as I said before, we're investing more on preventative measures. But if a child has already progressed and the child needs rehabilitation, that center is open for each and every person. That's an emphasis of the new MEC, to ensure that the center is not only limited in this urban area, but even parents who are in rural areas who don't have solutions, who don't know anywhere to go to. They must go to our offices. Each and every village has got an appointed social worker that is deployed in that particular village. So what we're trying to do is to ensure that the first access, you go to your councillor, you go to your social worker. Social worker will obviously do assessments, and those assessments are taken through the value chain up until this level to ensure that the child is in a position to receive immediate action. And that center offers, the interventions that are offered there are world class. The detoxification of children to ensure that once they leave the center, they don't relapse. And the relapsing rate is quite low as compared to other centers. It's because of the investment and the work that we do when we rehabilitate.
Mzukisi Solani, thank you so much for your time.
Pleasure.
Well, Peter, there we have it. In commemorating this very important day here in the Eastern Cape, there are some programs that are running, mainly to also educate, create awareness, and just to mention that Ernest Malga Center here in the Nelson Mandela Bay Metro has a 9-week program that runs. And to reiterate what Mzukisi Solani has said here is that throughout all communities, it's a matter of, trying to find an office close to your social development, going to report that you have an issue like this at home and getting that help. But for now, it's back to you in studio.
Viewer, thanks very much indeed. That's our reporter, Viopote, there speaking about the scourge of addiction abuse in the Eastern Cape.